second talk is going to be from Alfonso Santamaria Gadea, who's part of the ERS Junior. Good morning, Alfonso. Perfect. He's going to talk about differences of ENT training among European countries. Please go ahead with your presentation.
Perfect. Thank you, Puya. I'm Alfonso Santamaria, and I'm going to speak about the differences of ENT training among European countries. The ENT as a medical specialty has undergone significant development in the recent decades. Of course, the advancement of the technology applied with robotic endoscopes, also with the development in surgical fields, with the skull-base surgery, transoral surgery, and also with the extension of our competencies with the facial plastic surgery, audiology, phoniatrics. And in 2008, the European Union of Medical Specialty, the ENT section, creates the European Board examination in otorhinolaryngology, trying to unify this ENT training. But despite these facts, there is a lack of consensus in the ENT training in different European countries, and difference also in basic condition, different duration of this training, different modes of entry in each country, different easy to access to the received formation and access to the doctoral degree, and also different final examination, and of course a different level of satisfaction. And despite this fact, there is a few data on this field has been published, and that's why from the ERS Junior Board has tried to study these differences. This was the aim of our project, was to assess the different training condition and level of satisfaction of the residents and the recent ENT who has completed their training in the different European countries, and of course to compare all of the results, focusing especially in the specialty of rhinology. We use a self-administered anonymous Google form questionnaire from September to December of 2018. And we distribute it by email and the social media of the ERS Junior Board along the European countries. This questionnaire was designed by us in the ERS Junior Board, and we use the English language. We put 56 questions structured in different sections, which was general information, training structure, timetable, research training, salary, satisfaction, and future perspective. In results, we obtained 186 return questionnaire from different 27 countries in all Europe. Of course, we classify by each country, but also we classify the data as Eastern, Northern, Southern, and Western European countries. Try to make easy to show the data and to analyze this huge amount of data. And now we're going to see the main or the more interesting points that we have been studying. This is the most represented countries that we obtain, and this is the this is the age and gender distribution of our cohort. We see the you see the this is the average age of our cohort, and this is the gender distribution, which more or less was half and half, and this is a big differences between the Eastern and the Western countries. And now talking about the training structure, this is the data about the average age where people begin and it's the specialty, and and about the duration of the training. This is both aspects. It's important to show that in northern countries, people try to start later, and also the duration it's bigger, especially comparing to the eastern countries. And now regarding the type of the hospital, most of people do in university or public, and the private hospital has a very few representation only in Western countries. And in the case of having or not having an obligatory regular assessment, most of people have it, especially in northern countries compared to the Western countries. And regarding having or not having an exit examination, it's very common in all European countries to have to have a final examination, especially again in the northern countries. But the European board examination is not very widespread. Only the 4% of the people who answered say that it's compulsory in their countries, or they put as an examination on each country. And now, speaking about the option and duration of the subspecialization, only less than a half people has an easy way to do it, and no big differences between have been shown in the different countries, and the duration is usually less than 2 years. And regarding the research training, few people have time during their timetable to do that, and most of this research training must be done after the official timetable. Like when you finish the training and you're an staff member, it's similar. So this graphic shows us the level of satisfaction about this 5 affirmation. Near the 1 it seems totally agree, which is positive, and near 5 it represents the worst qualification. And most of them are in the midline, and no big differences. Only maybe the northern countries has a better punctuation, but no big differences. And now the same punctuation, where 1 is totally agree and 5 is totally disagree. The people answer that if it's easy to find a job after the training or not. Most of them are partial agree, and only in southern countries it seems to be a little bit worse. And now these maps represents the average salary without income supplement in all the countries that we have responses. And you can see that in Ireland and Germany has the best result, which is in orange, and in the eastern countries has the worst results. This is the same graphic, average annual salary without income supplement, but we cannot compare the standard living between Germany and other European countries, for example, and that's why we use this PPP method, which is called Purchasing Power Parity, which is a method very stabilized in economics that try to homogenize this salary or these wages depending the standard living of each country. But using this method, the results were the same. Germany, Ireland has the best results. This is another map showing the annual salary with on-call supplement with no big differences, no changes. Also, Germany, Ireland, best results, and the Eastern country has worse results. Again, using this PPP method with on-call supplement, no big changes. And also we do a multivariable analysis, trying to analyze the relationship between these wages or salaries and the different degree of satisfaction. And we don't find any interesting relationship between this fact. So for the discussion, the studies have been analyzed these differences between ENT training and European countries. Only I find these 3 studying, but they only analyze 3 or 4 countries. So this is not the study with the highest number of ENT interview, but this is the study with the higher number of countries analyzed. So comparing the lineal data, in the northern countries tend to start the specialty later. In the eastern ones has a lower rate of women. And about the duration of the specialty, the tendency in all the European countries is to make the specialty for at least 5 years. And also the European Union of Medical Specialty, the ENT section recommend at least 5 years of duration. However, in the eastern countries has a shorter duration, near 4. And although it was implemented more than 10 years ago, the European board examination of ENT has a very little diffusion in European ENT formation. And usually each country has its own final examination, especially the northern one. And in most countries, there is a little or no time devoted to research on a weekly schedule. And this is especially marked in southern and western European countries. We don't have great differences in the degree of satisfaction and organization between the different European countries, and the distribution of the ENT wages or salary in Europe is irregular. even taking into account the different living standards of each country. And as a conclusion, that there is no major differences in the ENT training in the different European countries. The duration of the ENT training tends to increase at least up to 5 years. Little time is devoted to research during the ENT training, and the European board examination of ENT is not very respected and is not introduced in the ENT training in the European countries. And the different salaries are not related to a perception of having a better training. So thank you very much.
I think that you presented very well the different perspective that goes between different states in the Europe. However, there's a huge differences which I've seen between the UK and other places and other countries. The first question that comes from our audience is: have you faced out any differences between head and neck surgeon and a rhinologist or otologist?
No, we only study the ENT training in general, and then focusing in rhinology. We don't study the difference between the different subspecialty of ENT.
Okay.